Immunization Week, and Dr. Jamie Friedman joins us this morning with the shots your child may need. Dr. Friedman, good morning. Thank you for being here.
Thanks for having me.
Are the immunizations discussions still a hot topic? People are still confused over them?
Definitely. I think that partly immunizations are a product of their own success because we don't see a lot of these illnesses, but they are still out there and they're very dangerous. And some of them are actually getting harder to treat. So it's important for parents to understand what they're up against.
And what an appropriate time to talk about it, because it is National Immunization Week, so we can kind of go over the basics again, because there might be some new parents who are watching right now and don't know how it all works. What are the diseases that you immunize infants for, the little babies?
Right, so infants are more at risk for certain infections. Specifically, there's something called pneumococcus. This is an infection that can cause pneumonia, meningitis, which is an infection in the brain, or an infection in the bloodstream.
Okay.
And this one is extremely concerning because there's some antibiotic resistance to it, so it's harder to treat. Infants also need to be immunized against something called Haemophilus influenza type B. This is the one that says HIB on your card.
Right.
This also causes meningitis. It actually, before vaccines, used to be the #1 cause of meningitis in babies, causes brain damage, hearing loss. But the infection actually causes a lot of other illnesses, one of which is called epiglottitis. It's when part of the airway closes up and then babies can't breathe. I know, scary, right?
It is very scary.
Very scary.
Because you don't think that these things can happen to your child until they happen to your child.
Right, they can, and I've seen it, you know. I mean, I haven't been practicing for a million years, but I have seen some of these infections. They have been around.
Whether you have your own pediatrician that you go to or you go online, they usually give you this little chart thing that shows your birth immunizations, and they do 2 months, 4 months, 6 months, right? And then they go 12 and whatever you need to go. So that's kind of what the immunizations
That's what you're looking
look like,
at.
Okay.
Yeah, I mean, and there's also polio. Of course, we know about polio, and that's still around in the world. So we still need to prevent that. You're seeing the hepatitis B, because hepatitis B can be passed on from parents. Also, rotavirus. Rotavirus is an infection that causes thousands and thousands of deaths in children worldwide every year. And since we've been doing the rotavirus vaccine, the number of children in the United States that have the reduction in hospitalization from dehydration has been about 300 or more %. I mean, it's a dramatic decrease in rotavirus infection. So, so these are the things that are very concerning for babies.
When I took my 3 kiddos, and some of them, you know, my daughter is still in the middle of all the vaccinations. She's still fairly young. The older generation of my family, like, Shali, do not give them all the vaccinations all at once. You need to separate them because it's just too much for a baby's system. Is that the mentality, or?
Some people do think that, but what people don't realize that your immune system is made to constantly be working. As soon as babies are born, they are exposed to lots of offenders, right? The birth canal, air they breathe, nursing, they sit on the floor and put their hands in their mouth. The antigens, which is the part of the virus or bacteria that stimulates the immune system, the number of antigens in the whole vaccine series is a tiny drop in the bucket compared to what you're exposed to every day. Everywhere you go is germy. Everything you eat, everything that you breathe, everything that you touch that touches your skin, your body is made to fight it off. Vaccines these days are actually very purified. So the amount of antigen in the vaccine series, about 177. Years ago, when I was a kid, it was about 15,000. So it's very tiny. It's just to stimulate your immune cells so you can make memory cells and then fight it off when you're exposed.
But there are parents, Dr. Friedman, who are still very against, and they're very vocal about not having their children vaccinated. Are there laws now protecting those who may want to vaccinate their kids and they don't want their children to be exposed to these?
Right. So the state of California has a law stating that kids who are in school, so public school, private school, preschool as well, need to have their vaccinations, because you never know who you're sitting next to. You may be sitting next to a child with an immune problem who's on medication so they can't get immunizations. I have these patients in my office, and it's very scary for them because one of these vaccine preventable illnesses can be very damaging and devastating for them. So to protect the community, that's what the law is for. So if your baby's going to be staying home and not going to be going to daycare or preschool, you do have the right to take that risk and put them off.
Dr. Friedman, thank you for being here. Good information.
Thank you. Thank you very much.